Retinal disease and management has been my interest for quite some time. I've been in practice now for about 11 years. I grew up and did my training here in Michigan with a little stint in New York and Kentucky. Ever since I started practice here in Saginaw, I've had a really interesting and exciting experience. My patients typically come in with retinal problems, including macular degeneration, diabetic retinopathy. I see a large number of patients with retinal detachments. Typically, most of these vision-threatening issues are considered emergencies and need treatment in a fairly timely fashion. At Andersen, we're able to provide that treatment as the patient's needs dictate. We've used a number of technologies here at Andersen, including intravitreal injections to treat wet macular degeneration and branch retinal vein occlusions and diabetic retinopathy. We do a number of in-office treatments, including laser therapy for treating, again, macular degeneration and diabetic disease, to name a few. I operate over at the hospital and at our surgical center to treat patients who have retinal detachments and vitreous hemorrhage associated with diabetes. So we're at the leading edge of the technology that's available to treat patients with a variety of retinal disease. And I think the future looks good for most of our patients. There's a lot of research that's being performed. We've been involved with at least one study involving treatment of patients with macular degeneration and look forward to being involved in many other studies in the future. As far as diabetes is concerned, it's important that when a patient is first diagnosed by their primary doctor that they have diabetes, that there's some sort of eye exam performed to get a baseline examination of the eyes, because the retina can become damaged early on. If we can treat the damage before the patient becomes symptomatic, there's a good chance they'll be able to maintain vision for the foreseeable future. If patients start to develop loss of vision prior to coming in to see their eye doctor, then the treatment may be a little more difficult to perform, and it may be more difficult to salvage vision. So it's important to make sure you get your eye exam early if you've been diagnosed with diabetes. Macular degeneration is the leading cause of irreversible vision loss over the age of 60. The early symptoms usually include difficulty with reading, difficulty in recognizing a person's face, and difficulty with driving. It affects the central vision and may cause distortion. At the earliest time this type of symptom is detected, an individual should make sure they get in to see their eye care professional to make sure that they don't have macular degeneration. If they do, to make sure that it's treated promptly.